only Medicare is Medicare. It's really that simple. There may be plans called Medicare Advantage, but they are often pale comparisons to actually what Medicare is. They often, as you've heard, overbill the federal government. They often are not taking care of the people that they represent. And in fact, this one area I want to emphasize, 6% of people in 2021 had their claims automatically rejected. And when they went to dispute it, to appeal it, 80% of those were approved. It shows that they're just automatically delaying and disapproving care for people who need it. The top two companies that year, 12% denial, nearly 1 out of every 10 people. But those stats don't show the real stories that are out there. Let me share one of those real stories that won't show up in a stat because they never took it to the stage of disputing. And that's my mom. Last year at 93, she passed away. But in her upper 80s, she had a Medicare Advantage program. She didn't know that it was a private insurance program. She just knew a nice young man sold her on it and told her she'd get one extra benefit. But when she was in an assisted living facility, she had some healthcare needs. And if she was on Medicare, a doctor came to the facility that would have taken care of her. But because she was on Medicare Advantage, she had to go in network across town and she wasn't mobile. And she just never got the healthcare that she needed. That's not going to show up in that statistic of a denial or an appeal. It's just the reality of how Medicare Advantage works. That's why, as Ro Khanna was talking about, we've introduced a bill to say that you can have a private health insurance program. You can be Blue Cross Blue Shield Advantage, but you shouldn't be Medicare Advantage because only Medicare is Medicare.